Hi, I'm Marianne Baxter, and this is my Capstone project. Many individuals are seeking treatment every day for acute medical needs. We live in an era where, unfortunately, most hospital reimbursements are determined on patient satisfaction scores. We have lots of hospitals, which is a good thing, but also a bad thing because people are starting to be picky on where they're going to be going, which isn't a bad thing. Um, but we want to put our hospitals that we work at um, to be the #1 hospital in the area. So how do you do that? So my project for the capstone was focusing on keeping the patient engaged. I ended up doing the AIDIT model and then also hourly rounding and discharge phone calls. AIDIT, for those of you that don't know, is an acronym that stands for acknowledging the patient and their family, introducing yourself, the duration of how long you're going to be in that room or in that encounter for the day, the explanation of any tests or procedures being done that day, and a thank you. Okay. The description of my project was I was incorporating the AIDIT in service. Um, that also brings in the importance of hourly rounding. My main goal was to keep the patients engaged from admission to a week after being discharged. I was going to help train staff on discharge phone calls and also help educate and follow up with how staff is doing AIDIT. I was going to have the front desk keep a log of how many times the call light goes off and keep track of the rooms and reasons why patients are using their call light. This will help us see if hourly rounding was going to be completed and if it is working. My mentor was going to be used by giving me feedback on the project and also how it was going along with the other staff members. And then also kind of be like ears to the ground to see how if people are really interested in the project, if they have any concerns, any complaints, when I wasn't on the floor, so I could be able to keep track of how it was going. My preceptor was Megan Thomason. I picked her because she was an experienced RN. She had her BSN, which was like a requirement, and she also was just really easygoing. She had great ideas. She is an RN over 8 years, and she is also a charge nurse. So I thought that would be great for my project. Yeah, so the goals for my project were to encourage staff to use AIDIT, teach the staff importance of hourly rounding, and train the staff on discharge phone calls, decrease call light usage by hourly rounding, and receive higher patient satisfaction scores. So the analysis of my project was pretty interesting. The things that went wrong were when I presented the idea to the staff. We did a couple of staff meetings, just like around the first day, like the huddle is what they're called. Some of the older nurses were kind of annoyed and they didn't want to do AIDIT. They thought it was a waste of time and that it took too long to do. That was mostly from like the older nurses that had been there for years and years. They were already set in their ways, which was kind of difficult. And then also finding time for doing discharge phone calls because it took such a long time. On our floor particularly, it was a very busy floor. It was with post-surgical floor, so we had patients coming and going, being discharged, being admitted all the time, and you had to be available on we carried like cell phones around and not being interrupted when you're making the phone call to the patients, because that's kind of disrespectful if you're trying to make a conversation with the patient that's already been discharged and all of a sudden you get disrupted, you have to hang up. So that was a big problem that we had to encounter, and just trying to find time to do the discharge phone calls. Also, what threw a wrench into my project was, which is a good thing, is I got hired on at a plastic surgeon's office as their RN manager, and so in June I had to leave my project that was in the hospital, which I had just barely gotten up and running, and I felt was doing a really good job to starting in another facility where I was able to take everything that I was incorporating at the hospital and turn it over into the office that I had started working at. So to evaluate the progress of our project goals, we have my manager who was watching the hospital come out with quarterly like ratings, kind of is what you would call it. But basically they were watching the scores, and they were trending up, which was good toward the end. And also the log of the call light usage up at the nurses station showed that the only people that were using the call light were for just like piddly things after a while. So that was really nice because we could track and see who was actually doing hourly rounding, which helped a lot with decreasing the amount of call lights that were being used, and ultimately helping the patient be more satisfied with the patient care that they're receiving. The benefit of doing this project for our hospital, obviously, I mean, customer satisfaction scores are very important right now with Medicare cutting back and trying to cut corners on trying to make payments to hospitals. And if you have happy patients, you get better satisfaction scores, which mean that you get reimbursements for your hospital, which are greatly needed. Happy patients equal happy employees because they're not being pulled into different directions all the time, which equals a happy boss because your boss doesn't get complaints. Our boss would do rounding every day. He'd go to different patients that were there and just ask them how their stay was, how their patient care was going, and if there's anything that we could do better. And by the time I had left, which was in June, he had seen an increase in patient satisfaction, and patients were actually naming nurses, and also we call them PCAs, but they're CNAs, them by name, telling the manager how awesome we were doing and how comfortable they were doing, so that was great. The benefits of doing this project for my professional growth is that I have become better at being more aware of the patients and their needs, and also keeping them involved. I've also understood. Before, I used to think kind of that being a nurse was you're taking care of just the patient, but from taking the BSN program, I've also learned that you have to be able to be aware of the hospital or the facility that you're working at, because that reflects patient care. If you're, for example, at the place that I work now, it's a elective surgery, so people are happy. When they're happy, they're going to come and they're going to spread the word. They're there because they want to be there, not because they have to be there, like in a hospital setting. So if you are giving excellent care, they're going to spread that, and your business is going to boom. So it's kind of like a business. So I have learned that through this BSN class that you have to treat your place of employment and be aware of, the needs of the facility. The other things that I've learned as in leadership skills in this project were not to be pushy. So when I am teaching people, like for example when I was doing the in-service, I've learned not to only have it in my head that my way is the right way and not listen to people. And leading by example, I think, improves that a lot. And then also adjusting goals, not being set in one particular way. Take feedback and adjust your plan, because ultimately you want to be able to make your establishment be a better place. And then also listening to your fellow employees, your coworkers, because all of your ideas can be great in your mind, but then when you go out to incorporate them, if people are using them and seeing a different way, or possibly another way that could make the project or goal that you're going to be doing better, listen to them, because they can have different ideas that can help out. So again, my project was to focus on the patient care, and also to keep the patient engaged in their hospital stay, from the time that they're admitted to the time that they're discharged a week after. To help with the aided process, I also developed a little superstar um, recognition program, and it is called You're an Aided Superstar. I'm going to show you what it is in just a little bit, but what I did is I came up with a little slip of paper that says you're an aided superstar, had the person's name, the date, and then they're recognized by who and why they were recognized. And someone, like another coworker, for example, would see somebody that they were working with, and if they caught them doing the aided module, they would go ahead and fill out the piece of paper and then put it up in the break room, because everybody likes to be praised. It makes them feel good. It helps them out. So this is what the paper looked like. Can you see that? Chlorinated superstar. It's totally backwards for you, but for me it's totally great. This was received well because on our unit, I think a lot of people crave that praise, and to be able to be recognized by their staff, their fellow co-workers and staff members, it really helped boost the morale on the floor and help them recognize that this was a good thing. We also started discharge phone calls. We came up with scripts that we would ask the patient how they were doing, if they had any questions, if they had any follow-up instructions that they needed to go over, if they were able to pick up their prescriptions, and if they wanted to recognize anybody for doing something great. So I think that helped a lot. We were able to just fit in discharge phone calls. We found that when there was downtime, we would just hurry and have our phone with the charge nurse at the time, so we could be able to have like 10-15 minutes of uninterrupted calling. Our goal would be to make 5 phone calls a shift, and hopefully have all the discharged patients contacted within that week that they were gone. The hourly rounding we incorporated for the call light usage was we had a log up at the front with the HUC, and every time a call light would go off, she would answer it and then also put a little dash by the room number. We as a team would correlate, so a nurse would have 5 patients, a CNA would have 10 patients for the night, and we'd correlate between each other just to say, hey, I'm going to start off at this end, you start off at this end, and if it wasn't too chaotic or crazy, the nurse would also do vitals when they went in, so then that freed up time extra for the CNA, so when they came back through, they could go quicker and then just make sure that the patient didn't have to go to the bathroom, make sure that they were positioned correctly, make sure their pain was under control, and then made sure that their personal belongings were close to each other. So that really helped. It really helped keep the call light usage down, which made it quieter and also helped the patients be more relaxed, because they were able to know that, hey, my nurse is going to come by, or somebody's going to come by within an hour and a half sometimes, and check on me and see how I'm doing. That also helped the patient's anxiety levels, which was awesome, because you weren't giving out a lot of Ativan, or a lot of the times if they had to go to the bathroom, they were kind of like on a bathroom schedule. So that was really great. Doing this project will help me in the future with my practices. I'm more aware of my patients' needs, and I now introduce myself automatically when I go in and take a patient to their room. I say, hi, my name is Marianne. I'm going to be your nurse today. It only takes a couple of seconds to say that, and it really makes a difference, because they know who I am now. They know why I'm in the room with them. They're not scared. Takes the pressure out, the anxiety out, so it helps them know what the role is, what the routine's going to be. I always explain now when I go in to see a patient, I say I'm going to take pictures, we're going to get your weight, we're going to look at your incisions, we do that kind of things, and that really helps the patient just kind of know what's going to happen and not be surprised or scared. So we're going to open up the floor now for any questions. So we'll take some questions for the next couple of minutes. Do you have any questions? What's it like to be a superstar? Aided superstar? Oh, it's awesome. It's great. What was that? What's it like to almost be graduated? This will be the last project? Oh, that feels awesome too. It's great. I love it. It's gonna be super. But what's it like to be a graduate of Dixie State University? Oh, that's awesome too. I tell all my friends where I got my BSN. It's pretty awesome. Okay. That concludes our capstone project with you, and I'm super excited to get this done with. I've been working on this project for a long time. So I just want to say thank you for the opportunity to do this class, and hopefully now that I'm finished, I'm going to do some world traveling, but probably not. I'll probably just be working and enjoying not doing the bachelor program. I am planning on, but actually I can't say that. I really enjoyed it. And I really am looking forward to advancing, and if I could give any advice to anybody that's going on to get their bachelor's or thinking about it, I would say definitely go for it, because it does make a difference, and you get more knowledge, and with the knowledge is more power, and just enjoying this adventure. So thank you so much, and I'm graduated. See ya.